Okay, all right. So welcome everybody. We're on to more case manager training. We did a little bit of manager training just to sort of get everybody into the Kantime University and sort of figure that out a little bit on, I think it was Wednesday. Today it's Friday the 30th of October and we're kind of going into the next level. Couple of things that I want to kind of go over today. So I want to send an email out about the planned timing of our rollout and how that's going to work. I also want to make sure everybody here can get into Kantime University. And then really what I want to focus on is helping you prepare, the whole team to prepare for all of the rollout and the recertifications. And what you will need to do in order to be ready for that recert and how those of us in the office can help you. So Marie and Libby and Kyle and Christine, how we are going to try to help you in the background. The nice thing about, there's lots of good things about Kantime, right? There really is. I think it's going to make everybody's life better. But it will be a bumpy couple of weeks, right? We're going to sort of like when Kelly Noel came over to us and she had to do a lot of, all at once, had to learn how to use Access all at once. It's going to kind of be like that for you all, where you're going to have to learn Kantime all at one time. So we want you to have the time between now and when we actually go live. And go live is, sort of a funny thing. Go live really is where, we'll go live probably next Saturday, and then one patient at a time, we will bring them on according to the time of their recertification. So you need to prepare that your first recert, probably your first 3 or 4 recerts you're gonna learn a lot and you'll probably feel frustrated. So what we want to do is get you really trained as much as we can on recertification so that you can navigate that and not feel completely lost the first time you go in and do it. And there are things you can do to prepare for it. So the biggest thing that you'll need to prepare for is moving the care plan over into Kantime. And we'll show you today how to do that. And we'll sort of do it as a 101 exercise, right? We'll show you how it works and you can start getting in there and playing around. Our real patients aren't in there yet. We only have a couple of test patients in. And then we'll come back again and give you more training on how to specifically do it with your patients going forward. So we're going to show you how to do the care plans and get those in. When you enter the care plans, they will be entered as interventions, more or less. And those interventions will basically become your treatment administration instructions and record. And so we'll show you how to do it today, and we'll also show you what it looks like for a continuous care shift nurse to go in and do a visit and what it will look like on his or her side. So what you enter, we'll set it up so that when that person when your shift nurse goes out to do a shift, she will go and she'll do each of the treatments, etc., each day, and she'll enter it into Access rather than doing it on paper. The same thing with Mars, right? So the heavy lifting here right now is moving everything that's in your Excel spreadsheets for your Mars and TARS into this new system. And then the nice thing is once you make changes going forward, they will automatically populate. So if you have a change in med or you have a change in treatments or whatever, you do it one time, you'll do it in this system, and then it will automatically populate onto your MAR and TAR, and your nurses will have what they need to do their job. So it'll be, I think what I want to teach you today is how it works. And then next week we'll come back and I'll suggest some efficiencies on how to actually enter it from your Excel spreadsheets into Kantime. I've been thinking about it a little bit over the last 24 hours and just playing with it. And there's a hard way and there's an easy way. And I'm just going to teach you how it works today. And next week, I'll teach you how to practically move stuff over so that it's not super, super painful. It'll be a little painful, I'm not gonna lie, but it will be, once we're in, it'll be much, much easier for you to do stuff. You won't need to send out MARs and TARs anymore. There really won't be any, we're not gonna go over them today, but there won't be any additional seizure logs or, you know, any kind of logs, you know, whether it's, you know, vent logs or suction logs or any of that. It's all gonna be in here. And we'll make it possible for you to have a better perspective of your patient at any given time. You'll be able to go in at any time and see what's happening with your patient, see how they're, you'll be able to QA the MARs and TARs, how things are going anytime. You won't need to go into the house to do that. You'll be able to do it from home or from wherever. So there are lots of advantages, but it is, you know, it's a new thing. It's going to take some time to get used to it. So first thing here, so I just sort of explained that. I'm going to open up the timeline, and please interrupt me if you have questions as we go along. I'm sure you have lots of questions as we get into this, and there'll be questions that I definitely cannot answer, but I'll do my best to find answers. Okay. Kantime Go applications. So we will be living this. Oh, hi, Christine.
Hi.
My gratitude just shot through the top. I need help. Okay, so can you see my screen? This it says start a care recert list for starting patients in Kantime. See that screen?
Mm-hmm. Yes.
Okay. All right, yes, everybody. So here's this. This is going to be our every single day. We will be looking at this list, and we will be updating where we are. So for Marie and Kyle and Libby, this almost needs to be up on your, I open it all day, all the time, so that you know where all of what's happening, and you, as changes get made, that they get made here, as well as anywhere else they have to get made. When we talk about having good communication, right? Everybody always talks about, oh, we need to improve our communication. This is where communication begins on how we will do this. If you're looking for how we're going to do it, who's doing what, when things are happening, how you find out. So I will send everybody, I believe I sent it in the email, a link to it, and you should try to live in that document on the link, and this is where you're going to go to find out information. So I'm going to walk through the spreadsheet so everybody understand how it works and what's going to be expected of all of you, so that we can stay in connection and communication. So I fully expect that what's here today will change. This will not happen exactly the way it's planned out right now. Things will change, and that's why it's super important that all of you are aware of this spreadsheet so you can keep track of where things are. So here on this first column is the name of the patients, and they are right now certed. So somebody's talking in the background, please mute yourself, unless you have a question. So this column will show you all of our patients, and they are in order of the scheduled time they will start in Kantime. And their start in Kantime will be upon either their recert date or their start of care date. So right now, this tells us the actual date. So this column, so I'll go from left to right. So these are our patients and the current plan of who goes first, second, third. So right now, James Breyer is the first, followed by Adeline, followed by Christian, followed by Janice, followed by Sincere. So that is actually our first week of Go Live is November 9th through 13th. So these are the first ones we currently have scheduled to go live. Now, this start of care date could shift a day or two. It's depending on what dates we have to fall within over here. So this is the earliest date that they can recert, and this is the latest date they can recert. So somewhere between here and here is when they need to recert. And Marie and Kyle and Libby and all of you will need to work together to decide what the best actual dates are so that it works in your life, it works in your schedule. This isn't, this isn't written in stone. It just needs to be within the earliest and latest dates. And you need as a clinical team to make sure you've decided this as soon as possible, because it's going to push a lot of other decisions. So again, patient according to the order that we're going to bring them onto Kantime. Their initials, I have that for a reason I don't need to talk about right now. This is, column here needs to be updated daily by Marie and Kyle and Libby. This is going to tell us at any given time which system the patient is on, because it's going to get confusing. Is the patient right now on agency core, or is it on Kantime? Is the patient right now on private duty, or is it on Kantime? So this will tell the whole company which it is. So once James Breyer gets opened, Marie's gonna come in here and she's gonna write to Kantime, right? And now we know that James Breyer is no longer on agency core. He is on Kantime. So that's every day we're gonna be looking at that and updating it.
Hey Coco, I just have a quick question.
Yes.
If patients are discharged, so should I just like email the supervisor group and let them know to have them removed from the list?
Yes, that's a great point.
Because
Thank you,
Sincere Covington has been discharged, so he's like one of the first 5.
Great. So we'll be able to. So we'll need to update that, and I'm just going to hide him for now. But Sincere's gone. So we'll. That's why this spreadsheet will have to be extremely dynamic. And looking at it, and probably Marie, when you do your morning huddle, you're going to be looking at the spreadsheet and saying, okay, here's what just happened. Here's where we are. Here's the patients that are rolling over, etc. So thank you for that, Kelly. And you'll probably look through here and maybe find other patients that don't belong here at all. So, okay, so then here this column is, it's saying, is it a recert, or is it a start of care, or is it something else? What kind of a transition point is it? Again, here's where, if it's a recert date, here's the earliest date it can happen. Here's the latest date it can happen. Here's the actual date it's going to take place. This column says, is it a skilled medical patient, or is it a continuous care patient? This column is who's the case manager assigned to do the recert. So this may or may not be the person who's assigned to the patient ongoing. That I will leave certainly to Marie and Kyle and Libby and all of you, but this is the person who will be assigned to do it. And so if your name is somewhere in here, you're going to be like, okay, I got to be ready for that. I know that's coming. I got to be ready for it. So that's the case. So we want to get these filled out, and I'm sure that Marie and Kyle and Libby will work on that. Especially, we want to make sure we know at least 2 weeks out at all times who's doing it, so everybody can get organized and prepared. Of course, things change, right? That we're in home care, so things happen every day and things get moved around. But this will help. This is meant to be a communication tool to help you see as a case manager. And also ambassadors, we'll talk about in a second, how, what you should be prepared for and when. Then we have who is going to enter the plan of care and the Marantar to prepare for this recert. In the beginning, I predict we'll probably do a fair amount of that in the office for you, especially for continuous, because they're so massive. But as time goes on, you will be responsible for input. So here's where we're going to say, okay, I got this one, right? I'm going to go and do this. Coco's going to enter all the data for James Breyer for the MAR, the TAR, and the data, or in the plan of care. Or Libby's going to do it, or Marie's going to do it. We're going to get you ready, and so that you feel comfortable. Or it may be a combination, right? So we're going to use this as a communication tool to say who's responsible for getting this specific information in, because this information is what will either cause you to, like, ideally you have this already in the system, mostly anyway, before you go in to do the visit, or you're going to get really far behind on data, on your documentation. So we're setting you up to win by deciding up front who's going to enter. And this is, again, going to be largely the decision of Marie and Kyle and Libby and you, right? Looking at your week, looking at what you've got going on, and whether you can do it, or whether they're going to do it, or even I would do it, or you know, other members of the team. This column is who's the
Sorry,
ambassador.
Coco.
Yeah.
I just had a question on that.
Yeah.
Can we enter our information at any time, even if it's longer than 2 weeks till the recert date, if we have the time? Like, can we start putting in data for all our patients when we can?
That is the hope. So right now we are, yes in general, but not quite yet. So right now we are in the process of getting some final touches on data that needs to be loaded in, including the patients themselves. And so we are hoping that by early mid next week, the patients will be in. This, as soon as your patient is in the system and has a record, you can come in and do this. So I highly recommend, Stephanie, that you go in and do that in advance. It's going to be hard at first, and really not hard at all once you get a system. And if you wait till the day you're recerting and you're trying to enter it all in, and then you're trying to figure out how to do the recert visit itself all in the same day, it's going to be a shit show, right? But if you like you're suggesting, no, okay, I'm going to just sit down, plug away, get all my MARs and TARs and pound cares loaded up early, then you're going to be fine. So I will let you know as soon as possible on as soon as we have the space open. So today we're gonna take you into the real site and have you look at, we have a couple of test patients that are in there, and you can get in there and start trying it out and doing it yourself. And then we'll talk about how to build in efficiencies again next week. Does that answer your question?
Yes, it does.
All right, and then, okay, so this is the clinician to enter the data. This is the ambassador. So the ambassador, of course, is important for the continuous care patients. It's not so much important for the skilled medical because you don't have an ambassador. The ambassador, this is basically saying to them, and this is why column G is so important. Not only is it telling your case manager when this recert's going to be, it's telling the ambassador, okay, this is the date in which you need to start entering schedules for Adeline. And you need to stop entering schedules into Access Home Care, private duty. And so we want to stay nice and connected on that. And we want to know the date of start or recert as soon as possible, so that Nanette and Jennifer aren't, are ready and the date, and it's clear. And then what that's also doing is it's communicating to the people in the field which system they should be doing their documentation, right? So the trickle down effect here is huge. So if I am Nurse Nancy out in the field and I not really paying that much attention, I forget, and I log into Access and there's no scheduled visit in Access, well, then I'll know, oh, I got to use Kantime. But if Nurse Nancy goes into Access and there's a schedule for today's shift in Access, even though the patient's already moved over to Kantime, then she's probably going to put it in the wrong system, and she could make a mistake, and that's more cleanup, and that's causes, you know, heartache for everybody. So the timing of getting the recert or the recert or start of care date nailed down, and even the time of when it's nailed down, I can add a column for that, Marie, of when we think it's going to happen, so that we are correctly assigning shifts to the right system. And so this is where Christine is going to need to coordinate heavily with her team, right, to make sure they know which dates to cut over. All right, and then the other piece that's in here.
Sorry, I have a question about that.
You bet.
So when we do the recert window, the 5-day window,
Yeah.
that visit is certifying the new 60-day plan of care. But
Yes.
the LPN visits would be under the previous plan of care. So would they automatically switch to the new system on the first day of the new cert?
Yes.
Okay.
Yeah, so that's, I want to make sure I understand your question. So yeah, when you switch over to a new cert date, everything that you do the recert, and on that moment of recert, that's when we move everybody over, including the LPNs in the field. Is that the question?
No, so that's what I'm saying. So like say James Breyer was done on the 10th, first day of his 5-day window.
Okay.
But his new cert does not actually start until the 16th. So the old plan of care is covering the time period through the 15th.
I got
So
it.
I was asking if the LPNs would start charting on the first day of the new cert, the 16th.
That's a good question. I don't know. Marie, do you know?
They probably could. They would probably start charting on the first day of the cert.
That makes sense.
Yeah, because that's how we're going to train them too, is just before the cert period. So we'll train them to, right, Christine, to start charting on the first day of the new cert.
I guess that makes sense from a billing perspective as well.
Well, also
Yes.
no interventions. If you put the interventions on starting on the 16th, they're not going to show up in their notes until the 16th.
That's right.
Yep.
Okay. All right. Thank you for that clarification. That's important. So then I revised what I said before for the ambassadors. It's not, they don't start scheduling in Kantime for a patient driven by the start of care date, or the recert date, but rather it's driven by the first day of the new cert period. Is that right? Did I say it right?
Yes, so that'll be easier too, I think, to determine. We'll know exactly when the transition's taking place, and it won't be so dependent on when the recert is done in the window.
Exactly. So that's good news. Okay, that's helpful for me and for everybody. So that's great. So I will add a column here, ladies, that's on the first day of the new recert. And that would be the day that ambassadors would start to schedule. And that's good news. So we can start getting that in. Okay, so thanks for that. Great question and thoughtfulness. So we have the ambassadors, the other things that we're going to be coordinating here. So Jennifer Coleman is, as the new patients get imported, each patient has to be set up, their payer information has to be set up. So she will mark when that's done. Christine will mark when the continuous care schedule is ready. Taylor will mark when auth has been entered and is ready to go. And Christine will also indicate for those that it applies if the home health aid schedule is ready to go. So all those things will need to get coordinated, and it'll be through this spreadsheet that we keep track of where we are and who is where. I will show you, there is the first week, looking at my calendar, November 16 through 20. So I'm assuming you're going to do these recerts on Monday through Friday. So the first week is actually November 9 through 13. There are a total of 5. what's scary is the second week. The second week is November 16 to 20. And there are 23. So we need to know that. That's the worst of all the weeks. All the other weeks are way more manageable for reasons that I don't know. This is just a heavy duty recert week. I don't know if that's a bunch of Kellys. I don't know, but there's a lot here. And so we'll have the first week to sort of get our feet wet on this, but we really need to be prepared for that second week when we get kind of blown away. Now, most of them are, well, there are a lot of continuous in here. It is possible that we could, and I'll, this is something I'm going to talk to Marie about. It's possible we could put off some of these for the following recert, which would be in the middle of January. But it's, we need to do that cautiously because our access skilled medical system will turn off at the end of January. We have more time with continuous. That system will go on longer. But that second week, I just be prepared. That's going to be a crazy week. Questions about how this is going to roll out so far? Okay, so next thing on my list is I want to make sure everybody has access to Kantime training and Kantime, the actual system. So I'm going to do a new share. Let's just. All right, so here is what, the Kantime system looks like. I'm showing you the real system, not the training system. So kantimemedicare.net, you come to the login page. It's your first initial, last name at Illume, not Illume Cares. It's not your email address, .com. It's this. And then it's, when you first go in, it's welcome 1, 2, 3, 4. That's how you log in. So you could actually, right now, if you want, go in and you can log into kantimemedicare.net and go in and log in, and you can see what I'm about to show you on your own computer. So when you go in, you log in, this is our live site. There is not a lot in here yet, but there is some stuff. We're starting to get in here. I'm not gonna do a full training for you. Instead, what I'm gonna do is I'm gonna just give you a sense of what this page looks like and point you to where all the training is. So if you click on this button, it always brings you back to this sort of dashboard screen. And then if you go into client, you can see your client list, right? You've got referrals, clients, staff members. You won't have access to everything I have access to. Clinical, schedules, etc. You probably won't have timesheets or billing or accounts. So you'll probably have maybe referral, client, staff, maybe not staff, client, and clinical, and schedules. So I'm going to show you client list. And here's our pretend patients that are in here. And you'll see that you can kind of go into any of these and play around in there. I'm going to go into this Rona practice Rona, who's here. And this is what the chart looks like. And I encourage you to come in here and play around. So this is a chart that we manually entered. We tried to make it kind of similar to one of our patients and getting it up and in there. So you have general information. You'll see the patient information is here, billing address, treatment address, who's the primary physician or primary care physician, attending physician, any information on hospitals, other physicians, so you can add as many physicians as you have, and emergency contacts, right? So this is all basic stuff. Start of care information, resumption of care, pharmacies, any custom fields that we don't really have much in there yet, and referral information. You'll see all this stuff, any kind of notes. So this is like the basic page of the profile, the general information. The next section here is you can see any assessments that have taken place over time could be listed here. You can see the episodes that have that the patient has had, and any care that has been associated with. So this is the admit number one. There's an admit number, and the certification period is here. If you had more episodes, this is the current episode. You can also see a list of episodes, but this one doesn't have it. If there were orders, the orders would all be listed here. And again, I'm not going to go detailed into these. These are all videos that I'm going to give you access to. You already have access to in the Kantime University, and you can learn all about it and play it in that system. But here's what it looks like. Here's where the plan of care ultimately goes, and you set up schedules, who's planned to go in to that patient. These are all of the authorizations. I don't know if you can see the authorizations or not, but this is where they would go. Care plans. So this is this section that will need your time. I mean, all of these things will need your time in advance, right? You know better than me what will need to be entered. There's a certain amount of data that will pull over, but there's a lot of data that's not going to be in there. Where I want to make sure you are aware is with the care plans. This is where you would enter the various parts of the care plan. And so there's a section, there's goals, and you have all the goals that are listed, and then you have interventions that are listed. And the way you add a goal or intervention is you can add from a library, and there's a whole big library. So here's the library, and these are ones, you select your discipline. Your patient, right, is either a pediatric patient or it's an adult patient. So it's always going to be one or the other. You select the discipline, and then you come in here and you select the type of where, sort of, is it general, is it cardiovascular, what is the area? So if I look at cardiovascular, it pulls up all these different things, and you can select which things you want. This is a goal. You see, this is the goal section, the orange ones, and then down here below are the interventions. So if you want it to be a goal, then it would go up here. If you want it to be an intervention, you go down here. You can also like take this and you can write whatever you want here, okay? And so again, if I was working with this system, I would probably open up my Excel spreadsheet that has, or my Word document that has all the goals, and I would copy and paste them, right? I would just go, okay, goal 1, copy, paste here. And then I do goal 2, copy, paste here. I do goal 3. Etc. If you're doing a start of care, however, you might actually look at all these and see if you want to use any of them. It's up to you, right? Whatever system you already have in place for how you do your start of cares or how you do your plan of cares, it's up to you. This is totally editable. And then down here, you'll see that these are interventions. Interventions will show up on the TAR, essentially. It'll become a treatment that on a continuous care shift nurse's note, on their visit note, they will have a list of things they need to get done, and they'll have to document having completed each one of them at the time, etc. So that's how you would think about this one. If I was going to go in and enter everybody's TARs, I would just copy and paste. First one. I'd copy. So, and here's the frequency. So you can say, oh, good, they fixed this for me.
We can't see what you're seeing.
Yeah.
Thank you.
I was just
like
gonna say
looking
that.
around, I'm trying to move my screen. I can't figure out why I can't see what she's looking at.
Okay, can you see it now?
It's a secret, Kelly.
Thank you
Yes,
for
now
telling me. Oh my
Now
gosh.
I can
better.
see it, yes.
Okay, apologies. So when you open up this this goal, you think it's called, sorry, I'm moving things around so I can see what I'm doing. Oh, shoot. Once you click on add from library, that's what this looks like. Okay, so this, I apologize. So now you can see what I was talking about. So this patient is a pediatric care. It defaults, you can't change it. This is the discipline. Is it skilled nursing, which includes all aspects of continuous care. Is it specific to an LPN, PT, OT, speech, aid, etc.? So if you go under skilled nursing and you click on the area, right? In this case, you've got cardiovascular, development, gastrointestinal, et cetera, right? You pick the first section. Here's where, I'm sorry that you didn't see this before. Here's where you see the top section is goals. So these are the goals. They're in orange. It says goals. This is interventions. This is where you would put everything that you put in a TAR. So if I have a goal, I wouldn't go through the trouble of trying to find the goal that matches in here. I would just click on this, go into my goals, wherever I have them stored in a Word document or in Access, and I would just paste goal 1. And I would just paste goal 2. Okay, does that make sense? This is again if I'm doing the recert. So you select those, okay, and then you got to save it. Now these are gonna get saved as goals, right, to your chart. Now you can go on down here to the interventions. This section, all these interventions, and this is specifically cardiovascular interventions, for example. If it's not a cardiovascular intervention you want to add, you can, if it's a neurological, then you would want to add it under a separate section. So, but again, let's go back up to cardiovascular. Coming on down here, if I were you, and I was trying to load up all of my TARs, I would probably just copy and paste what's in the TAR, like treatment number 1, paste. And then frequency, I don't know, give me a treatment. I'm not a nurse. Give me a treatment you might have. Suction 3 times a day? I don't know, making that up. Is that right? Suction 3 times a day. Let's say that's what it is. So we'll say suction, and whatever, however you'd put it. And you would say frequency per day 3 times, right? And now I go on and I go on to treatment number 2. And I paste that in, paste. And if it's 1 time a day, you put 1. If it's 3 times a day, you put 3, whatever it is. Are you following me?
Yes. I have a quick question.
Yeah.
So if you're, let's just say it's like an assessment of 5 things.
I'm having trouble hearing you, Plisha.
Do you have to put every assessment in a different box, or can you just like say assessed activity tolerance, shortness of breath, response? Sorry, it's like assessing something. Can you put all the assessment in one box?
I would leave that up to Marie and Libby. I mean, I'm talking more about this. I mean, this is for a continuous care intervention.
Okay.
Where it's like really important that you're, as a case manager, writing down everything that a continuous care nurse has to do. And then there's a place on the back end, I'll show you in a minute, where a continuous care note happens and where the nurse would put it in. Skilled medical is different, right? I think and this is where I'm going to have to ask a nurse, because I'm not one, to answer that question. But my sense is the answer is yes. What do you think, Marie?
Sorry, I didn't, I didn't get the question. What
So-
was it, Flechette?
My question is so let's just say I'm the cardiovascular system. If you're assessing 10 things, like during my visit, I'm going to assess vital signs, I'm going to assess for shortness of breath, I'm going to assess their O2 sat, I'm going to assess their activity tolerance. Can you like put all that assessment in one box, or do you have to put like each thing separately?
You can.
I think each thing is separate, but I think there's a general one that
Okay.
would encompass all of that too. So,
Perfect.
you know, go in there and look around and read them. It's quite an extensive list of everything. So, there some of them are pretty general that would encompass all of that though.
I mean, I'm just going to put on my compliance hat for a second, and I'm not a nurse and I'm not a compliance officer, but yes, you could copy and paste them all into one, but then you have to separately document that you did each one. But if instead you put them in each now as a separate thing, and then when you go in and you do your actual visit, you actually will go through the process of quickly, easily documenting that you did it, you might be saving yourself time. And you can also make sure that you're following what's in the plan of care exactly. So I'll show you what it looks like, okay, in a second to be on the other side of it. So you're setting things up for what it looks like now, but on the other side is what the nurse who's delivering the visit, whether it's you.
I have a question about this before we move on, sorry.
Yeah, go ahead.
So the interventions will be creating a TAR somehow? Is that what's happening?
Yes.
And is there another area where, you know, like our care plans now, they kind of have like a system by system instruction of what you're looking for in that system. And then our TAR is the actual interventions related to that. Where do those like paragraphs go?
I'm not sure, to be totally honest with you.
Okay.
I think we'll need to play with that, and actually I would love your feedback on it. Like as you get in there and look at it, because we're still trying to figure out where things go, and actually your feedback would be really helpful. Like, okay, so what I'm thinking is that, because what happens is you put all this together and it generates a lot of things. It generates a plan of care, and it also the MARs and TARs, actually just the TARs from this section. So I think part of this process is we got to get in there, and there's funny background music sound. Put everybody on mute for a second. So I think we're going to need, you know, you all to get in here and play with it, and then we'll probably realize how best to do it as we do it a bunch of times. So I'm sorry I can't be more specific.
And our adult continuous care people will have the same system?
Yes. Yeah, it's the same. So this patient happens to be a ped, but another patient that's in here is a adult. And so you can, you know, you'll be able to, they're all either one or the other. Okay, so that's the care plans. Well, you know, and that all comes into the plan of care.
Sorry, that's my last question.
Sorry, what was the question?
For things that don't have a specified frequency, or that we're saying like assess Q shift, how is that we working that in the frequency per day box?
I am not sure. How's that for an answer? So here's kind of where this information is coming over onto the plan of care. So this isn't an assessment, right? This is setting up the chart. And then when you go and you do the visit, you would do the assessment if there's an assessment. And then this is setting up the background. So this is not doing a visit. This is setting up your chart before you go and do a visit. Does that make sense?
Yes, and I'm talking more about on the TAR, a lot of our tasks, we're having them sign like every shift.
Okay, so I'll show, if you may, let me show you that. And you can see the actual, what I mean by the TAR and the MAR in just a second. And then we can figure out what, so this is like basically the treatments are now over here. And this is where you can see where I treatment pasted stuff here. So there's this is on the plan of care. And all the information, et cetera, that's in the plan of care itself. And it's by different sections. You can edit it here. Okay, so maybe this answers your question, Stephanie. You can edit it here, and you can add language here that goes on the plan of care that's not specific for the treatments. Does that make sense? So, I don't know, I'm gonna try this. Testing. Statement. And, you know, here's the 11-year-old assessment summary. Vitals normal range, right? You could put testing here. Aid tasks and frequency, risk of hospital. So there's a lot of stuff that's in here that you can add. And this is to the plan of care. All right, again, I'm not a nurse, so I apologize. So this is where you're gonna see, you can add pieces here to this in the plan of care that's separate from what's in your interventions. Maybe that's answered, maybe that's how you do it. So it's here, and then, so now if I go in and I've got to save, now if I go and I go into schedules and I go into client, and I'm gonna, this client is Practice Rona, and I go to Practice Rona, and let's see if I have some dates here. So if I'm Practice Rona, and let's see, the 31st, here's an RN shift nursing task. I go into, where is it? Oh, chart. Oh, this one's because, let's see. See if, oh, it needs to be assigned. I'm in here, so I'm in. So save, see if it'll let me chart now. It's not letting me chart on this one, hold on.
Maybe because it's a day ahead, it won't let you chart.
Oh, that's exactly right. I'm on the wrong date. You're absolutely right. I ran into this yesterday. Okay, so here, I'll do this one. Today's October 30th. See if it'll let me save myself. Okay. And now I can chart. So here's what the shift nurse would do then. Here's what they're gonna see. So I check in, defaults to the time of the beginning of the scheduled shift. Okay, so here's what the continuous care visit note is, essentially. So we've got patient information at the top, continuous care RN shift nursing PD. And so you'll see here, there's the pediatric visit, interventions, goals, medications, supplies, notes, forms, documents. So you can see here, the vital signs can get put in here as many times as you want in a given visit. You've got all the various areas that you would do the assessment. This is what you would look for: pain, GU, equipment. So this appears, just so you know, supervision and conferences appears in all nursing notes. We just, for shift nurses, we would just have them click not applicable. So you have all the different pieces and you have narrative, and this is where the narrative every 2 hours. So we would do, 7:05 a.m. Narrative. And then you would just keep on adding as time went on. So this is where all this happens, care coordination. Now, again, you have to click save. Now, if we go over here and we look at interventions for Rona, you can see all of the interventions, which is like a TAR. And then you can perform an intervention. And so, okay, whatever, here's my treatment 1, right? So I'm saying I'm doing it, and the time right now is 9:54, and whatever, comment and save. So now I've suctioned and I've done whatever and I've made comments about it. Now I close, and now it's done at 9:54, comments, etc. And so this is where, instead of having a piece of paper, instead of having a piece of paper that they're going to write on, this is where the interventions are. You're setting up the treatments and who it's done by, who it's done on, etc. If so it's me who's doing it, it's always going to be me. So which section, you can have it, here's all the different pieces to it. Does that make sense? And again, I'm just starting to get used to all this too, but this is where the interventions go. This is where the TARs go, how you set them up. You probably is as a continuous care nurse, or if you're you're going in and doing visits, to Plachette's point, right? So you would perform something, and instead of having to write the whole thing out, check for this or that, you can then come in here and select that you performed whatever treatment. And
Gogo, if I could just comment, if we go back to Plachette's great question when we're putting in the interventions, when we see this piece now, how we're documenting against the interventions, I do think they need to be listed pretty specifically. I think it's more work on the front end, maybe by breaking them up, but it certainly looks much cleaner when the documentation takes place.
So, and then you have, if you need to print it, there's a print function here. There's also, for a long, so it looks like a TAR kinda, right? This is for today's treatments. So it's here. The same thing applies, right? So that's how the TAR is set up. So in my mind, there's a lot of work to get the TARs rolled over, plan of care set up. The other is the meds, especially for continuous care who have so many meds. So if I go back now to, sorry, my screen's doing something weird here. Okay, so I'm gonna close this. Okay, and close this. If I go back to my client list, there's probably another way to do this, but this is what I know. So if I go back to practice Rona and I go to meds, this is where you would set up meds. Really similar to what we just did for treatments, right? So this is the meds that have already been inputted, and there's more information down here, infection form, etc. But here's where you put the meds. So you would put new med, and you would enter, you would enter your meds here and any details about it. Oral, and I'm not a nurse, so I'm going to make a jerk of myself here. And then, frequency. I know you guys have special codes for that. I don't know what it is. So you put this start date, DC date, etc. So you add this in, and now it's on their MAR. You can keep adding meds, adding meds, adding meds. So instead of doing the MAR in Excel, it all comes over to here. Then again, when you go into the schedule and you look at the same visit we were just looking at, we can come back to that. So I'm looking at Rona, I'm looking at today, I'm looking at me. See if it'll let me go back and chart again. And I go in and I look at the MARS, the medications. It says to me, here, show medications for this visit, right? So here's where the medication, the dosage, the frequency, any other details, clinician, done on, given by, et cetera. So administer med, come in. Okay, so aspirin, I'm the clinician. I do it at 9:59 and oral and tolerated, and I save. Okay, and so now I close.
Can you go back into the medication area?
Sorry? Oh,
Go back to medications.
Can you see, where, back to where you add them?
Yes, I'm just wondering,
Yes.
there's a button that said like plan days and times, and I'm wondering if you
Yeah.
can build it so they know what time they're supposed to be giving which meds.
Yep. Let me see. Let me close. So again, I'm just looking to see if I can go anywhere else here. No, I guess I have to go here, and then I come up here. There's probably an easier way to go back to the client, but here, this is what I know how to do. So if I go back into meds up here, this is where I'm adding the meds. So now I'm in the chart, right? I'm in the meds. I can add a new medication. Tell me what I should enter. Medication, whatever you want.
Go back into your aspirin that you just put in. Anything. I want you to click on that plan days and times to the right to see then if on the MAR
Yeah, okay, plan days and times.
under administration above.
Oh, okay, here we go. There you go.
Okay.
So you could say like every day, right? And time, comma separated times. So 7, 12, 1600. Enter the, okay, route oral. And I just did 4 times daily. And save. Following fields, days on, days off. Oh, sorry, I don't need that. I want every day. There we go. So if there's a certain days you don't want on, say save, close. So now we have this aspirin, right? And 3 times daily, et cetera. So this is this one I just entered. So now if I go back into the schedule and I look at, oops, it wants me to close out of here first. Save. Okay. Schedule, clinical, schedule, client calendar. Here she is. We're on a patient, October 30th. Come back over here. I go to chart. I come into the meds. All right, so now we've got this one. We're going to administer meds. So 7, 12, 14. So, okay, so now I'm going to click here to administer meds. And maybe the parent gave it at 7, around 3, oral, tolerated, and the clinician at 12, 24. Okay, so now I save. Close. So now here it is. So we've got aspirin, frequency 4 times, Sunday, Monday, all days, 7, 12, etc. And now it was given by the parent, 703 oral tolerated. Then it was given by me, 1224 tolerated. So that's
So
how.
it looks like that's what we'll have to do to build out similar to the MAR. If a
Correct.
med time is missed, is there any alert given if it's missed or not documented on?
We haven't set that up yet, but there is a way to do that. So right now we don't have the alert set up, but that's something we'll add. And so we can, QA it more actively. So today, I wanted to sort of give you, a picture of how we'll be setting up these particular parts of the system, and what for continuous care especially will be, I think, a lot of the preparation work. And, for you to go ahead in and start learning how to enter stuff. I mean, to take a plan of care or a MARTAR from a patient you have and to come in here and try and experience it for yourself is really what I'm hoping you'll start to do over the next couple of days. And then what I would say is in the next week, we will have access, everybody will have access to the actual patients, and then you'll want to come in and take the time to start actually entering information from patients. So now I'm going to show you, I'm going to jump out of here for a second into Kantime University. So this is a different site, and I sent you a link to that one. And it's green. You'll notice that it's green versus blue. If you're in, because once you get into Kantime University, you'll notice that it looks very similar to the actual Kantime system, because not only does it have a section where you watch videos and see your training dashboard, but it also has a whole functioning running system that you can play in. The reason I didn't demo what we've been doing specifically in Kantime University is that it doesn't have our interventions all set up. So there are some differences. Our lists of values aren't loaded into Kantime University, but you'll see here as I log in. So again, it's the same username and password, first initial, last name, and the first time you'll log in, you'll log in using welcome, all lowercase 1, 2, 3, 4. It'll then spur you to immediately reset your password. You come in, you do your login. This looks the same, right? It's instead of blue, it's green. It has all the same things at the top. So you'll be able to see referral, client, staff, whatever you normally can see, you'll see here. But over here there's an additional tab that doesn't exist in the other main system. And this is where you would come in, you click on clinician. My screen will look different than yours because I am an admin user, but what would happen is you'd click on this button and immediately your training appears. For me, I have access to everybody's training. So I'll just come down here and show you like this. When you come in, what you're gonna see looks like this. So when you click on this button, when you go to training clinician, and you click here on this little dashboard, training dashboard, it's going to pull up this view, and it's going to show you all of the videos that have been assigned to you. It's going to walk through all the things that I did not today. It's going to show you about the dashboard. So if I click here, it's going to open this up, and you can learn about the clinician dashboard. Then there's office communication, confirming schedules, PD nurse admit, PD nurse recert. Definitely going to want to, everybody's going to want to pay attention to this video. PD nurse visit note. So this is the regular visit note, the start of care, the OASIS recert, OASIS discharge, adult visiting note, missed visit, and orders. So these are videos to help you really learn the details of how to operate in the system, which I did not, right? I was really honing in on the things that I know we'll need to do in order to set up for a recert. but this will show you how to do each of these things. The other thing that is set up in here for you is you'll notice this is again this is your training dashboard. Shows you all your videos. Once you finish video, this red will turn to green. It also shows you, so this is your list of videos that you need to accomplish, and as you finish them, it'll turn green. It's also going to show you that you have things that have been assigned to you. So you have a regular adult visit, you have two adult visits and 3 supervisory visits, a PD recert, a start of care or 2, discharges, recert, start of care. So these are things that are already in the system, along with some forms that are waiting for you. And so how you get to those is by going into, you can go into schedules, you can go into clinician or client, but for you, you're a clinician, you want to see what's on your schedule. So if I go to me, Coco Selman, I'm going to see these have been assigned to me. And they, as I complete what's here, they are going to mark off that they're complete in my training dashboard. So there may be more here than you actually are going to want to actually do. I'm not going to go crazy about this, but I wanted to make sure y'all had plenty of stuff to practice on. So, and you can also go into up here into clients, client list, and you can, you know, look at various clients, and you can do all the things in here, right? You can do the care plans. You can see what happens when you add then what the plan of care looks like, if that in order. You can add assessments here. You can look at past assessments. You can add assessments. So if I'm going to do add assessment here, I can, is it going to let me? So you could do do a recert here if you wanted to. So there's recert date. So you can play around in this training environment without hurting a thing. Not just went somewhere, I don't know where. Let's see. Cancel. So that is the Kantime training portal, and that's a good place for you to play around. And get to know what's in the system. As soon as we have the patients in the system, our actual patients, then that's when we'll start to go, okay, let's get those patients according to the timeline, right? According to this timeline, let's get James ready to go, and Adeline, and Christian. Let's focus on them first. And we'll all help, or you look and see where are your people. So this needs to be filled in, but where's your name on this? And then go ahead and focus on in that order, your patients that are coming on board. Any other comments or questions?
I have a question. Are the patients being like hand entered, or there's some kind of import that they're able to do?
There is an import. There's an import, but what I am not 100% sure about is exactly all the detail that's in it. Let's see, Kantime. Here. I don't know where Jen's final version of this is, but I'm not sure what exactly goes in it, but I know it's a lot. There was a ton of stuff that got put in with it, but it's not going to be everything. It's not going to be your meds. It's not going to be your plan of cares. I know that. But there is, date of birth, and, a lot of detail will be put in. I think they're going to match up the physician, the primary physician. There's a lot that will be in, but there's certainly going to be a lot that's not there. Any other questions?
Can they import our physician list, Yeah,
it's in there. Yeah, the physician list is in there. All the NPI numbers, addresses, phone, fax, their license numbers, all that has been entered. Most of I can show you. So if I go back, sorry, this is hard to get to. There we go. See if it'll let me. So there's a lot that's been loaded in here. So
Yeah, all the employees are in there already,
right,
staff,
there's
all the doctors. I think we have the payers in there. There was just a few tweaks that we needed to make, and that's why we delayed it a week, so that we could get some other reports in there.
oh yeah, they're reloading all this stuff now. There's a ton of data. So if you go back to these are all things that we've imported. So all of our physicians, third-party allergies, client import. I'm not sure if this is the latest and greatest. It's not. But this will give you a sense for like what's been in, what the data is. So patient.
We got referral sources in there. We've got doctors, we've got clinicians,
Last
we've
name,
got,
date, yeah, address, social, Medicaid. There's payers.
interventions and goals.
Right.
Amy
this
did
one is-
before she left for
Right.
us.
So there's a bunch of stuff that's going to be in the system already, but there will be things that we have to add in. Clinicians, DME library, all of the facilities, all the physicians, referral sources. You know, there's a bunch that's in there, but no doubt about it, there's a lot that will have to be added.
Yeah, they told us they would do initial sweep and then they'll do one just before we go live, just to capture anything that's new that's in access. They'll make a final sweep for us.
Will the schedule still appear as like block scheduling, or it's going to be a list of whatever the assigned tasks are?
Let's see, I'm not sure I understand your question.
You know, like our access continuous care schedules now are in that block scheduling calendar. Will they appear similar, or it's just going to be a list of the tasks?
You can, I believe you can see it in either format. So,
Oh, okay.
so I don't know if you can see this. Can you see this?
Yes.
Is that what you mean? So like this is the schedule for a patient.
Okay.
So
Oh, nice.
I'm sorry, what?
That's nice. Yeah, that's what I was asking.
Oh yeah, sorry. Apologies. So this is by month. This is by week. So you can see it that way instead, if that's easier. I know there's an easier way to do this, but I'm still learning. If I go back to another way, you can look at it by the list. So if I look at, I pick a patient and I look at schedules here for that patient, it's listed as a list here. So you could look at it this way, or you could go into the schedule and see it by client in the way, like, it looks like a calendar, or you could look at it by clinician and look at it either way. As far as scheduling goes, this scheduling system is way better. I won't go into all the details about it, but it makes it really, like, we can set up schedules a lot more easily and into the future, and create schedules and reuse schedules, and it's much more user-friendly in that way. So I encourage you to all kind of get in there and play around with it, and let us know what questions you have. You'll probably have lots. We will be doing follow-up training next week, probably Tuesday is what I'm thinking, Tuesday, Wednesday. Again, we'll make it recorded so that you can listen to it later if needed. And that will be the sort of the moment where we say, okay, it's time to start really going in. So what I would ask you all to do is to log into Kantime University and do the training in there. You know, if you can't get it all done, especially all the visits, I wouldn't worry about that. More importantly is just to sort of get your arms wrapped around how to update the record of the medical record and the chart, and how to do your TARS and MARS and set up the plan of cares. You know, as a cheat, we can attach a plan of care that's written in Word and attach it. But, you know, at some point we're going to need to break it down into TARS and MARS, and it's going to be much faster, I think, if you guys just do it in advance and do it in here the right way. That's all I got for today. Marie or Libby or Kyle or Christine or anybody have anything else you want to add?
No, I'm good. Just if anybody is having a hard time getting into the university, to please reach out to me so I can ensure that you have the correct logins.
Yeah.
And play around. Don't be afraid to go in there and play around. You'll find that it will be easier than Access. It's actually, once we load everything and get everything over the initial hump, it'll be a great program. It really is.
Okay, guys. Well, thanks for being here.
Have a good one,
Spend
everybody.
the morning with you. What was that?
I said, have a great day, everybody.
Have a great day. That's it.